Great.
Um, so welcome back from the break, guys. Hopefully everyone's back. Our next speaker is Ronnie Rothschild. She is a senior physician assistant at Lenox Hill in the Neuro ICU, and she'll be talking about um, what it's like being a PA. So, yeah, take it away.
Great. Let me make sure you guys are able to see this. Do you see the slides?
Yes, they're working
Thank you.
now.
Okay, perfect. Let me just see okay, perfect. Cool. All right, so thank you so much for that introduction. Yes, my name is Roni Rothschild. I'm a PA at Lenox Hill Hospital. I'm a senior PA in the neurosurgery department, and it's been almost 8 years since I've been here, which is wild. Time definitely flies. And then a little bit about myself and how I got here. So I grew up in New York. I grew up on Long Island, and I went to Emory University undergrad. And that's where I was a psychology major and a global health minor. And it was my junior year of college where I discovered the PA profession. So I'm excited to tell you guys about the PA profession so that it's something that's on your radar, if it's something that you guys are interested in, if you're interested in going into medicine, that it really is just another wonderful option for an area in medicine where you can have, very impactful hands-on um, um, experience and practicing medicine. Um, so yeah, after Emory, I came back to New York, and then I did studied at the PACE PA program, which is affiliated with Lenox Hill in the financial district downtown. And one of my electives was in neurosurgery. And towards the end of my rotation, they were looking to hire. And so I interviewed, and I feel so lucky and so blessed that I'm still here 8 years later. It's been a dream, and we have a phenomenal team over here. On this picture, I guess it might be a little blurry, but I got this directly from the PACE PA program website, and it just has a few of my former classmates on there. So this is like a pretend picture, but now everyone's practicing medicine. I'm in neurosurgery. I see Mark in this picture. He's in urology. Dan, I think, is in like orthopedic surgery, maybe. So there's a lot of variability of what you can do, and we'll get into all that. So before I start, does anyone know what a PA is and like what a PA stands for?
Someone
All
said
right,
physician assistant in the chat.
that's right, physician assistant. So when the career started, we started calling ourselves physician assistants, and now there's a little bit of not a debate or a trend. We're working on transitioning or reinventing ourselves and um, being called physician associates. People feel like the title of a physician assistant, it just sounds like all you do is assist a doctor all day, every day. You're just working under a doctor right there directly, and you're just assisting them your whole day. And it doesn't really capture the profession well because there are so many PAs who are working completely independently. And I'll tell you guys about, what working under a doctor's supervision can look like. So We are trying to reinvent ourselves and being called physician associates, but that is correct. We are PAs, physician assistants, or physician associates. So we are a relatively new profession in medicine. So if you think about doctors and how long they've been around, doctors have been around, the physician profession has been around for hundreds, if not thousands of years. The first official or formal medical degree in our country was in 1769. It was at King's College, which is now Columbia University in the British American colony. So that was a long time ago, I would say. And then nursing has also been an established career for hundreds of years, but the first official class of nurses graduated from the New England Hospital for Women and Children about 100 years later in 1873. And then you have the PA profession, which the first graduating class graduated from Duke in 1967. So that was only 58 years ago. It was not even 60 years ago. So, we're a relatively much newer profession. So what I think is interesting about that is that whereas being a physician, being a nurse is so well established. You see a doctor, you see a nurse in every single medical setting, no matter where you are, no matter what state, what city, what little rural town you live in, you know what a doctor is and you know what a nurse is. Whereas the PA profession is kind of still in its infancy. There are people who grow up in this country who don't know what a PA is. It's possible they've met or been taken care of by a PA, but they probably assume that they're a doctor or a nurse or a resident or a fellow or something like that. So, there's a lot of work that needs to be done for people to recognize PAs as PAs and for what they do. And we're a rapidly growing profession. There's more and more PA schools opening up and more PAs graduating every single year. And more people are just going to have a better understanding of what a PA is and what PAs do and how instrumental they are in the medical field. So I'm just curious, before this talk, did anyone not know or not hear about a PA? Curious, but anyway, we'll keep going. Oh, 1 second. Sorry about that. Okay, so how did the PA profession come about? So in the 1960s, there's a shortage of primary care physicians. And it's around this time that there's a lot of very experienced military corpsmen coming back from the Vietnam War with a huge and extensive medical knowledge base from being kind of light doctors on the ground in Vietnam, taking care of a really, really acute patients. And they have all this medical experience and they come home and they don't really have anything to apply it to. They're not doctors, but they want to continue to sort of practice medicine. And they didn't want to go to medical school. They were already established in their lives and careers, and they wanted to hit the ground running and practice medicine. So Dr. Eugene Stead sees this as an opportunity to create this new profession, the PA profession. And they modeled the coursework and the schooling to get their training based on the fast track training of doctors during World War II. And the first class of students, it was a class of 4, and they were all former US Navy hospital corpsmen. And I'm pretty sure that a lot of them went into like emergency medicine or internal medicine type of field. And since then, there's been hundreds of programs that have opened up around the country. And it's a very rapidly growing profession with a lot of opportunities in it. And whereas, they started in like emergency medicine, internal medicine, primary care, now you'll see PAs pretty much in any field of medicine. You'll see them in pediatrics, and more specific to that, like pediatric ENT, pediatric gastroenterology. I'm in neurosurgery. I have dermatology PA friends, orthopedic surgery PA friends. Wherever there's whatever field of medicine, you will find PAs now. PAs around the world. So it's kind of fascinating too that there are doctors and nurses all over the world. And it's an established career in every single country. But the PA profession is not, you can't find PAs in every country. It started here not even 60 years ago. And a handful of countries have started adopting the PA profession and incorporating it into their system, like Canada, South Africa, the United Kingdom, Netherlands, Germany, Australia. And there's more and more countries who are trying to bring the PA profession because they see the value in what PAs do, the gap in the medical system that they're able to fill. And in more and more countries all over the world, you're seeing the PA profession more and more. There are some countries where with a USPA degree, you can practice as like the equivalent level of practitioner in their country. So, in some countries, you can go and practice, but they might give you a different title, like a nurse practitioner kind of. You'd function like a nurse practitioner. In South Africa, it's not called a PA, it's called a clinical associate. But in practice, we do similar things. So you might travel one day and come across a PA in another country. But what is a PA? So we kind of talked already about the title, physician assistant, physician associate, and what we are licensed healthcare professionals who practice medicine. So we do everything from taking extensive medical histories and doing a physical exam, diagnosing a medical condition, getting all the lab work that you need to medically diagnose something, the imaging that you need to diagnose something, a CAT scan, an MRI, an X-ray, an ultrasound, whatever diagnostic tool that you need, we are able to order that. And any medications that patients need, we prescribe medications. So we basically do everything that a doctor can, but we just practice a little differently. The schooling's a little different, and we'll get into that. But pretty much, essentially, for the most part, whatever a doctor can do, PAs can do. So you're doing a lot, and you're very involved, and you're very hands-on. in patient care. We work under the supervision of a physician. So that looks very different depending on where you are. I mean, it's different from practice to practice, state to state. It looks a little different, but in order to practice as a PA, if you have a supervising physician, that does not mean that they need to be in the same room as you practicing medicine all day, every day. So what that might look like if you're a dermatology PA is you have a supervising physician. So part of your practice, one of the doctors is considered your supervisor, and you go into a patient's room, you see patients completely independently. You're looking at whatever medical condition, rash, lesion, whatever's on their skin. If you need a biopsy, you're getting that biopsy. If you decide that they need a steroid cream, you're ordering that steroid cream. You're doing that completely independently without having to speak with them about the decisions that you're making. The great thing is that they're always available to you. So if you have a question, if you're not sure about something, if you need a second pair of eyes or someone to bounce ideas off of, they're available to you. But you're working very independently. If you are a PA practicing primary care in rural Kentucky, you probably don't have a doctor with you in the office even. They're probably a phone call away, miles and miles away, and just available to you if you need anything, and really just allowing you to prescribe medications. Because if you need to prescribe something, it needs to be under the supervision of a physician. And so you need to be able to have someone's NPI also attached to your prescription. So, for example, for me working here at Lenox Hill under the supervision of the physician, the person who, my supervisor that I communicate with the most is actually my supervisor who's my PA supervisor. If anything comes up or any issues or questions, concerns, or anything, they're my go-to. I take care of patients who are all neurosurgical patients and there's, neuro patients, attendings who are doing brain surgery, spine surgery, and there's several doctors who I'm taking care of their patients, but I'm not directly taking care of only one of their patients. So just to give you guys an idea of how much independence you can have as a PA, you can be very independent. The only situation that I can think of where you really are assisting and you're really under a physician's supervision is in the operating room. Like in the operating room, for the most part, you're really first assisting a surgeon, and they're doing a lot of the work, I imagine. I'm not in the operating room, so I can't say. But even in that situation, they're probably, if you work together for a long period of time, there's things that the surgeon is going to be comfortable with you doing independently, even in the operating room. But a lot of PAs in the OR are first assisting. But there's a ton of specialties that you can go into. And I think I've already touched on that. You can be in emergency medicine, internal medicine, neurosurgery, orthopedic surgery, cardiothoracic surgery. And those are just surgical subspecialties. You can be in gastroenterology, urology, you name it, any field of medicine, you'll find a PA. So there's a lot you can do. So at this point of the presentation, you might be wondering, wow, this career sounds amazing and something I want to go into. So let me tell you how you can become a PA. To start, there's a lot of prerequisite coursework. The important thing to note, though, is that every PA school has their own prerequisites. So it's very important that if you're going to try to become a PA and go to PA school, you really have to get an understanding of what the prerequisites are for the schools that you are applying to. Some want biology, chemistry, microbiology, organic chemistry, and some want microbiology but not organic chemistry. There's big variation. It's not standardized. So make sure you know. Okay, oh, I see the chat is, there's some questions. Great, I'll take a look at the chat in a minute after the slide. So the prerequisite coursework is very important, that you're very organized and paying attention to the school that you're applying to, and that you're hitting all of the coursework that is required. You need I think for all schools at this point, you need like a bachelor's degree, unless you're somehow like applying to a program that is like built into your bachelor's degree. But for the most part, it's at the graduate school level. So you do your bachelor's degree, and then it's graduate school program. So prerequisite coursework, direct patient care experience. So what that means is they just want to see that you have experience taking care of patients to some capacity. And the spectrum is really, really broad on what you can do here. I had very hands-on patient care experience. I was an EMT for a few years before I even went to PA school. So if it's something that you want to do right after undergrad, you sort of just have to plan ahead. During your schooling, you have to make sure that you're hitting all the prerequisite coursework, that you're doing what you need to do to become an EMT, so that, and be an EMT like on your campus or over summers, and getting all the experience so that you can apply to PA school early enough to start after undergrad. But that's a lot. So some people to get their patient care experience are like scribes. So you're not really directly taking care of patients, but you're involved in their care because you're scribing for a PA or a doctor, and note writing. There's nurses who go to PA school, medical assistants who go to PA school. Any sort of hands-on patient care will get you the experience that you need to go to school. And then obviously you complete an accredited PA program, and then you have to pass the PANCE. So once you finish PA school, and we'll talk soon about what PA school is like and how it's structured and that. But once you finish that, then you take the PANCE. It's the PA National Certification Exam. After finishing PA school, everyone who graduates must take this exam in order to be able to practice and be a PA. And then in the state that you work in, you need to obtain a license to work in that state. And you can have multiple licenses from different states. I know people who live in New Jersey, practice at Lenox Hill, per diem in a hospital in New Jersey. And so they pass their PANCE, they have their New York State license, and they have their New Jersey license. I have a colleague who worked at Lenox Hill for a few years, moved to California. So she has her New York license and her California license. So it's pretty flexible to work in different states. So let me just check back on some of the questions here. Even though a PA is its independent title and a licensed healthcare professional, they initially endlessly work the job of a senior resident throughout their career. I'm not sure what what you mean by that. I mean, you're practicing medicine. You're making decisions independently. I think as a resident, there's still like a lot of oversight and running things by the attending and things like that. It depends probably on the setting. Maybe in some settings might be similar to working as a resident, but I mean, if you're a PA in dermatology, seeing patients on your own, then you're really not like a resident. You're really like a doctor. Do you work in the clinical setting too, or just the hospital? How does it differ? I personally just work in the hospital, but there are also PAs that work in an office setting. So that's something that people can definitely do, just work in an office. And I'm sure there are roles of PAs that, are working really closely with a doctor, and they maybe operate together in the operating room. They see patients in the office, and they also round on patients in the hospital. So random, if anyone has never mind. Seen creative management. Oh, okay.
And Ronnie,
How
we
is
have
the
some
coursework?
questions in the Q&A as well. Sorry to interrupt. If you want to stop for
Oh,
questions now, or we can wait to the
should I
end,
save
up
them
to
for
you.
later?
Up to you.
Okay, so I'll keep going with the presentation, and then we'll save Q&A for end.
Okay, sounds good. Yeah.
Okay. Yeah, I guess I have a lot more to go through. Okay. PA schooling. So depending on where you go to school can be anywhere from 24 to 36 months. So that's, I think, is actually really cool to have that flexibility. Nursing school is, I think, pretty set. I know medical school, no matter what, is 4 years, but for PA school, you can find a program that's 24 months, and that's just 2 years, or 36 months. That's a whole other year of paying tuition. So if you can do it in 2 years, I mean, that, I think, that makes a big difference. But there's pros and cons to both. I could see why someone would want to maybe like have their summers off, or do it a little bit slower, because doing PA school in 2 years is a lot of information very quickly. So if you can spread it over 3 years, some people might be into that. But no matter how long your schooling is, the didactic year is the year that you're in the classroom. So you're studying pharmacology, medicine, the practical skills of how to write a note, how to do a physical exam for every body system, everything that you need to know to practice medicine, the knowledge. And then the clinical year is putting everything into practice. You're seeing patients in different settings, in an office setting, family medicine, in the hospital, and you have core areas of medicine that, in order to complete PA school, you have to experience 5 weeks or so of a core area of medicine, which is like primary care, emergency medicine, OBGYN, pediatrics, and then most schools will allow for, I think, at least 2 electives. I at least had 2 electives. So I did mine in neurosurgery and oncology. And getting an elective is great for really finding out, usually an elective is what you're interested in. So it's really a great opportunity to see what it's like in practice, to see what PAs would do in that field, to see if you really like it, if it's something that you're really interested in. I think it's super important to not just go into PA school open-minded, but go into your clinical year open-minded. You never know what you're gonna like or what you're not gonna like. You might surprise yourself. You might say that you're totally set on becoming an emergency room PA, and then you love babies and want to go into peds. So always important, in work as in life, to stay open-minded. I actually, when I did my elective here in neurosurgery, I just really wanted to see a brain and see brain surgery. I thought it was so fascinating and so interesting, but the area in medicine was just way too, I thought, heavy. And I said, oof, like patients being diagnosed with brain tumors, like that's tough, that's heavy, that's not like light, happy day-to-day life. And so I just want to do the elective for the opportunity to see a brain in real life and brain surgery. And and then I loved it. I came in and I was like, this is very interesting, but I'm going to be in breast surgery. I'm going to take care of women, and post breast cancer, or battling with breast cancer, and be there for women and women's health. And I was all about that. And then, I had this elective and that changed things for me. So always important to stay open-minded, because I couldn't be happier. Post PA school options. So after you graduate from PA school and pass the PANS, if you don't feel ready to practice just yet, then there are options to go into fellowships. And I think the most popular ones are like emergency medicine or surgical specialty, like orthopedic surgery. I think that for people who want to go into emergency medicine, sometimes it's difficult to go straight from PA school into emergency medicine. So if you do a fellowship, it makes it easier, it makes your resume more competitive for getting a job that you really want. But I know plenty of people that also just find their first job, like me. So I feel like the first few years on the job for me was like a residency, but it was a fully paid one, where I made my living and I learned a lot on the job. And the first few years in any job, you're learning a lot, you're reading a lot, it's a lot of work, you're staying after hours because everything is new. And so it's very, very doable to treat your first job kind of like a pseudo fellowship or residency, because the expectation is not that you're coming to your first job with all of the knowledge base that you need to practice. You're going to be learning a ton. So everyone's different. I found it very seamless to go from PA school to starting a job, even in neurosurgery, and then just building on my knowledge base and building on my knowledge base to where I am today. So that's me in the middle. Let's see. So PA versus MD versus NP. So I saw that question. People, the question was, if you're a PA, is it kind of like being a forever resident? I don't feel that way. But in order to become a doctor, you go to medical school. You could practice right after medical school, but a lot of people do a residency, and then after residency, a fellowship, in order to become a nurse practitioner, which a lot of PAs and nurse practitioners practice pretty similarly. But in order to become a nurse practitioner, you have to become a nurse, and then you have to practice as a nurse, and then go into becoming a nurse practitioner. And within becoming a nurse practitioner, you have to decide in NP school if you're going to work in an acute care setting or a non-acute care setting. So if you get one degree, then it's more for being like outpatient, and then your degree doesn't necessarily transfer if you decide that you want to work like in a hospital setting. You have to make that decision if you want to be in the hospital or not earlier on. And then there's, being a PA, and you go to PA school, and then, in theory, you graduate, you get your first job, and that's all you need, and you're fast tracked to practicing medicine, and you're hands on taking care of patients from day one, and it's just a quicker way of doing things. So I think we talked a lot about this, where you can find a PA. One thing we didn't really touch on is, beyond practicing medicine in a hospital or in an office type of setting. Besides that, there's tons of PAs who are in administration, so in leadership positions in hospitals. So it's usually PAs who practiced medicine for a while, and then they got into a leadership role, and then they're managing PAs. And so, they're not really as hands-on with taking care of patients, but they're managing other PAs, and then, helping out with the hospital, day-to-day functioning of the hospital. So there's a lot you can do with that. There's PAs who also get like a dual PA business school career, and then you can sort of integrate that in doing administration and also teaching. A lot of PAs find it very fulfilling to give back, to do a lot of teaching. So you can like work in a PA program and help out, some professors in PA school probably only practice medicine like once a week, and they're spending the rest of their time teaching, but that's what is fulfilling to them, then that's what you can do. That's an option. So what's it like being a neurosurgery PA? So even within one subspecialty, there is so much variation and what you can do within this title. You can be an ICU neurosurgery PA, where all you do all day, every day is take care of really acute critical care patients in an ICU setting. There are some neurosurgery PAs who are just on the floor, so they're taking care of patients who are less acute, maybe like on their way to being discharged home or to rehab or before surgery, and just managing them on the floor and their medicine. And then at Lenox Hill, we have hybrid PAs, so we all do both. So it's an opportunity to be in the ICU one day, but you're also on the floor some days, and depending on where you are that day or that week, you do both. Which for some people don't like that. Some people like to be very focused and only do the floor, only do the ICU, and some people love it because it's very different. And so sometimes being in the ICU can be really, really exhausting, really acute patients. You can get burnt out. And it's a nice change of pace to be able to go on the floor. It's a different skill set. There's, in the ICU, you do more procedures. On the floor, less procedures, even though there still are some. You're seeing consults, discharging patients, a little different. And then we have a PA who's part of our team, whose just in the operating room all day, every day. She's in the OR. She's very skilled surgically. She does closures probably with her eyes closed and has so much experience that the surgeons completely trust her in there. And she's managing the patient's care perioperatively, making sure that they're, cleared for going for surgery, and that everything is in place for what they need for the operating room to happen smoothly. And we have PAs who all they do is INR. So that's a whole other subset of neurosurgery, is neuroendovascular procedures, through the groin, minimally invasive. And there are PAs who that's all they do all day, every day. So it's pretty cool. And there are some PAs who do floor ICU, but also do INR a little bit here and there and are trained in that. So there's a lot of opportunities. It's far from boring. Just because every single day you don't know what you're gonna do, where you're gonna be, what you're gonna get. It's always exciting. And then outpatient, I'm sure there are neurosurgery PAs who also, there are definitely neurosurgery PAs who do outpatient work. In our practice, most of the outpatient providers happen to be nurse practitioners, but there are definitely outpatient PAs in neurosurgery. And then a day in the life for me, my role is a little bit different within the department. My focus is on pain management and discharge disposition for patients. So, in the morning, I start bright and early at 6:30. I get sign out on all of the patients. By 8 a.m., we're rounding and seeing patients. We usually have conferences in the morning, vascular conference, spine conference, brain tumor conference that we're listening in on so that we know what the plan is going to be for our patients. Grand rounds. At 9:15 every morning, I have a IDR interdisciplinary meeting where I meet with social workers, case managers, physical therapists, occupational therapists, the nurses, bed management, and it's the whole team running the list, talking about the patients, what their needs are for the day, who's anticipated being discharged. If a patient's going from surgery and they're on the floor, they might need an ICU bed or telemetry after surgery, just so everyone's on the same page. And then from 10 a.m. onwards for me, working on discharging patients, doing a lot of education about how to take care of their wound and the medications that they're going home on. So that's a lot. That's what my day-to-day looks like, which is different from, what the other PAs on the floor in the ICU do. And then how to find the right job for you. So, if you're interested in becoming a PA and you're going to go to PA school, I just really encourage you all to stay open-minded throughout the process. Think about what your interests are and what you like. And then just take note as you do your clinical year, especially what you like, what you don't like. And then, when you're really at the point where you're applying to jobs, the most important thing that I think anyone can do for themselves before they start a job is meeting the people who you're working with, understanding why that job is becoming available. If a job opening is there for you because that job and role is a revolving door and people are in and people are out and people are in and people are out because a lot of people are unhappy there, that says a lot. But if there's a job opening in a department that is super busy and bustling and there's more and more growth, more and more opportunity, and that's very different. Or if they're a group of PAs or that have been there forever, but one person is moving to another city, to California, that says a lot, and probably looks different in practice. And so always shadow and get on the ground where you might be working. And then also important to note that nothing is permanent. And I think that actually is one of the most beautiful, fantastic things about being a PA is that there's so much flexibility for moving across specialties. So I've been a neurosurgery PA for 8 years. If tomorrow I say, I don't want to do this anymore, I'm actually really interested in plastic surgery, then I can find a job in plastic surgery, or dermatology or pediatrics or OBGYN. And it's that I'm sure that's a big challenge. You're learning a whole new skill set, a whole new knowledge base. But in theory, that's something that you can do. I imagine most PAs, once they find an area or field of medicine that they love, they stick with it. But there is the flexibility to move, especially if you're moving. I guess being in New York, a lot of people want to live in New York or move to New York, experience being in New York. And over the years, I've heard of people who are moving from another state, like maybe their significant other is moving to New York. And so they want to find a job in New York. And so it's really nice to have that flexibility where, if you worked in neurosurgery in California, and you're now moving to New York, you might not be able to find a neurosurgery position, but if you just need to get to New York, you can find a job. We have a PA who's like moved here from Florida, so I think it's important. And that's one of my colleagues, Kira. And so I was going to open it now to Q&A. Let's see. So I guess I'll go to Q&A before I go in the chat.
Yeah, awesome. Yeah, thank you for such an interesting talk. I think it really highlights how many critical roles exist on the operating team. And being a PA is such an exciting path for our brain interns to consider. So we have some time for questions. I can just start reading them off. So someone asked, what are the best research or elective experiences for a medical student hoping to get into neurosurgery?
I feel like I just can't really speak to that. If you're looking to get into a residency program in neurosurgery in the US, I don't think I can answer that one. I'm not entirely sure where to start
Okay.
to get here.
Another question we got is, and you touched on this a little bit, but how does the coursework and education differ in medical school compared to a PA school?
So that's a great question. The information is pretty much the same. It's everything that you need to know in medical school and to practice medicine as a doctor, you're learning in PA school, and it's just really fast tracked. And so you don't have as many breaks, and it's a lot of the same information, just expedite it so that you can become a PA quicker.
Yeah. And someone else asked, in your opinion, what was the most difficult part of PA school and how did you get through it?
I would say the most difficult part of PA school is just how intense and rigorous it is, and how little room there is for all of the outside social things happening with your friends and loved ones. So it's it's very difficult to make it to every social obligation that you'd like to go to when you're in PA school. It's just difficult with the workload and how many tests you're taking and the amount that you need to study. So like there might be a wedding that you miss or a birthday party that you miss, or important things that you might have to miss in order to complete PA school, which is obviously a bummer. But if you can see the light at the end of the tunnel and see the bigger picture, and you know just keep working hard to get to the end of PA school, then I feel like, once you're working and you're working PA, you have the world is your oyster and you have all the time in the world to have a meaningful career and work really hard and make a big difference and impact patients every day, and also have your life and go to any birthday party, wedding, any event that you want to go to.
Yeah, that makes perfect sense. Do you recommend any specific undergraduate majors or experiences for someone considering the PA path?
So I think the great thing about becoming a PA is that as long as you complete all the prerequisite coursework, it also leaves room as an undergrad to doing whatever it is that you want to explore. Like you can still hit all the prerequisites and be an English major or a history major. I was a psychology major. So I would really just encourage anyone to be open-minded and take the classes that they're interested in and do the major or minor that they're interested in. And as long as you hit the prerequisites, that's all that matters. It might be easier to have like a science major, but it's not essential. And I think undergrad, the education that you're getting is so interesting. There are classes that you should just take if you think the topic is interesting. So I would say if you can get away with it, major, minor, and whatever interests you. If you're going the PA route, then medicine and those types of classes are you're going to gravitate towards. So that might end up being your major, minor, but it doesn't have to be.
Mhm. Yeah, so someone asked if you can talk more about the entrance exam for PA school and how it compares to the MCAT.
So there's not really like a specific entrance exam to be a PA. I I want to say like some programs you need to take the GRE, but not for every program. So depending on where you're applying, let me check for PA school. You might not even need an entrance exam. Yeah, not all programs require it, but most probably do. The GRE, the Graduate Record Examination.
Awesome. And another question, can PAs work multiple specialties or are they limited to one specialty?
So that's the great thing about being a PA is that you can work in multiple specialties. You can work in multiple specialties at the same time. So I know one of the PAs that we work with, she's mostly in the operating room and she's a neurosurgery PA doing neurosurgery, but she also does a lot of cosmetics on the side. She has an extensive plastic surgery background, so she still does cosmetic stuff like dermatology, plastic surgery type stuff on the side. And so you can do it at the same time. Like you can have a full-time job somewhere and then per diem in a completely different specialty if you'd like. Um, or if you just want to, if you start in one specialty and you want to transition to another, that's something that you could definitely do.
That's awesome. So another question we got, can you talk more about what sort of led you to choose the PA route over another career like physician?
Why did I do that?
Yes, I think so.
So I always knew that I wanted to go into medicine, but I just didn't really have that desire to become a doctor. And if you want to become a doctor, like you just need that fire in your belly to be a doctor. 4 years of medical school, and getting into medical school is really, really challenging. Um, and and I know that along the way, there's potential for a lot of disappointments and moving around. Like if you want to do a residency, you don't, if your family's in New York, you might have to do a residency like in a other state on the other side of the country just to get into the residency program that you want. And if you want to do a fellowship, then once again you're getting uprooted and you have to do a fellowship potentially in another city in a different state. Like, and this is very common for medical school. Like people travel all over the country to go from medical school to residency to fellowship to practicing. And that's just not the lifestyle that I wanted for myself. And I wish I knew about the PA profession sooner, which I only learned about in my junior year of college when one of my friends said, like, hey, like my mom works in a dermatology office and she works with a PA and she like loves her job. And you should look into that since you're interested in medicine. And I did, and I was blown away. It opened a door to a whole world that I didn't know about, which is part of why I'm so passionate about giving this talk, because I think it's so important for as many younger people, who are still in high school even, to know what a PA is and does, because it's an amazing career choice. And if you want to be in medicine, it's not just doctor or nurse. There is a whole career, a PA profession, and we do a lot. We're very involved in patient care. I make a difference in patients' lives every single day, and I couldn't be happier.
That's awesome. So we're nearing our time, so let's take one more question. Someone asked, what surprised you most about working in neurosurgery, compared to what you expected going in?
So I think what surprised me most about working in neurosurgery is my ability to compartmentalize a little bit. I feel like I am definitely like a sensitive person, and I thought that, but I'm also like pretty happy and cheerful person. So I thought that if I worked in neurosurgery and it was constantly seeing patients who were like really, really sick, really critically ill, or with like terminal illnesses, that would really weigh really heavily on me, and that it would be hard for me to, function outside of work and still be my happy, cheerful self. But I think I feel very fortunate that I get to do really meaningful work, and I form meaningful connections with my patients, and it doesn't impact my ability to carry on outside of work and live my day-to-day life, and be happy. So